Right, our first session today is on the issue of marketing. Now, a lot of people in home care, you might think, marketing, is that really for me? But if you go out on the street, and I guarantee this, having written about this area for a long time, you ask people, what is home care? A lot of them won't really know what a quality service can bring. They also won't know necessarily where to find one. So actually, telling the public about what quality home care is and why they might need it and where they find it is essential. Which is why I'm delighted to welcome Nicki Wakefield, who is the Managing Director of Straight Up Marketing, the organisation behind the Care Marketing Toolkit.
Okay, hello everybody. Thank you for that introduction. Okay, today I'm going to talk quite a lot and quite quickly to cover quite a lot of ground. I'll very, very quickly introduce you to myself and Straight Up Marketing, talk about some of the typical issues that we've come across working with a lot of care providers, talk about 6 changes that make marketing so important to you right now, and obviously what you're interested in is getting people interested in your particular organisation. And it might be surprising to have a marketing consultant to tell you about things that you should do before you start marketing. I don't think marketing is necessarily what all providers think it is, so hopefully I'll get you to think a little bit about that. If you're going to start spending money on marketing, obviously you want to track what is and isn't working, and you might be thinking about how much should you spend on marketing, so I'll help you think about that. And I'll also tell you a little bit about the Care Marketing Toolkit that we've developed recently, because we've spoken to so many care providers, whether care homes, home care providers, multi-site organisations. Everybody seems to be facing the same issues, so this is a low-cost online resource. I'll give you a little bit more information about that towards the end, and hopefully we'll have time for a couple of questions. So let's quickly whiz through that. In terms of myself, I've been working in marketing for 17 years now. I was responsible for marketing in Bupa Wellness for 3.5 years. I worked in private hospitals for a couple of years, and I was head of marketing for a serviced office provider. And since I set up Straight Up Marketing, we've worked with dozens of care providers, including these organisations. So we've got a pretty good understanding of the sector, and hopefully there's some names up there that you maybe recognise. Most providers appear to have some of the same issues. These are the kind of reasons why people get in touch with us. They're trying specific things, they're not working, the people who are answering the calls are not equipped to handle them, they don't know how to make their website work effectively for them. So those are some of the issues that I don't know if they ring any bells with you, but they tend to come from a few key problems. One is about not thinking about demand and competitors. If any of you look on the CQC website, you'll probably find about 100 home care providers in your area. So you're not alone, and if you don't tell people that you're out there, they're going to find somebody else. And the next thing is about documented messages, being clear about what you actually want to say, and then making sure that those messages are consistently communicated throughout the sales process, from when somebody's first aware of you through an advert, to your website, to when the call is answered, to when you're following up those inquiries. And part of this is because of paper-based processes. In terms of tracking return on investment, that's often down to a lack of visibility of the inquiries that are coming in or who's visiting your website. So if you don't have any information, it's very difficult to work out where you should spend your money. Marketing is new to home care providers, and it's someone else's job. The manager, it's not the manager's job. That's not what I do. I provide care. That's my expertise. So, but it needs to be somebody's job. And obviously there's little money around with the local authorities squeezing prices. A lot of organisations are looking at the private sector, but they're nervous about spending money, partly because they don't know what's working and what isn't working. And one thing I want to get across today is that marketing is not just about websites and brochures. So hopefully at the end of this you'll if that's what you think it is at the moment, you'll have a different perception of it. So I'm just going to run through 6 drivers of change that I think make marketing important for you now. So the first one is about more people. So in the past, maybe you were communicating just with a couple of commissioners, care managers. Now you need to be talking to all sorts of people out there if you're going to be getting business coming your way. So that's probably, maybe in some cases, the potential service user, family carers, people who will signpost people to your organisation or another organisation, as well as varying people within local authorities, Health+Care, and the commissioners that you've currently got relationships with. I've already touched on greater competition and the number of organisations that are providing essentially what people out there will think of as a similar service. And if you are moving into the self-pay market, you're going to be up against your competitors more and more. So in the past, perhaps you had referrals come through to you and it was a done deal. Person comes through, you've got the work. Now you need to be, going back to the messages, you need to be clear about why you're better than the next one that they're going to see. So there's marketing and there's sales skills required there. The third one is all about evidence. Every website you look at pretty much says the same things. It says, we provide a high quality, personalised care in a cost-effective way, or something like that. So you need to get over that. People are more and more demanding evidence of how do you do that? How are you evidencing your outcomes? How are you clear that people are spending the time that they're supposed to be spending with the service users? How can you quantify how long your staff have been with you and how well they've been trained? All of these things are important to capture and then to communicate throughout the process. Obviously, I don't need to tell you that there's less money, but because there's less money, probably a lot of you are thinking about the self-pay market, but that's going to incur some marketing costs, but money's obviously an important factor. And the fifth thing is the internet. Obviously, that's not new at all, but it's something that I think the care organisation has been slow to embrace. And it's certainly for the public, for people of my generation, people of my parents' generation even, the internet is becoming the first port of call if you're looking for any kind of service. So the same is true for care. And having an effective website is critical because most people, as part of that journey, will visit your website at some point and they'll either be in or they'll be out. And then the final change is, well, it's about the potential value of every single interaction you have. So going back to the need for relationships with lots and lots of different people, if some of your staff are not interacting in a way that you'd like them to, that could stop you getting referrals from a certain person. If your inquiries are not handled effectively and somebody just answers the phone and they're asked, well, how much is it for half an hour? And they're told it's £10, please call us back if you're interested, goodbye. That could be a lot of money that you weren't even aware of. So critically, I guess you want to know how to get people interested in your organisation, and I think the important thing is that is to say that it's a process. So I'm going to talk you through that process. The first thing is about demand. So are you providing a service that people want? Is it the sort of thing that local authorities are commissioning? If they're commissioning more reablement services, for instance, are you providing those services? Or are you stuck in the service that you've always been providing and you're not aware what people are looking for? And that might mean looking at the services that you are providing or maybe coming at it from a different angle. The second thing is about why you're better than the 10, 15 or 100 other home care organisations in the area that people could choose. And that's going to involve understanding who the competitors are, and particularly who your best competitors are. Who are the ones that people find? What do they say to people? How much are they charging? What are they saying things that actually, we're really good at that, but we just don't know how to communicate that. So doing a bit of competitor analysis is always a good thing to do. And then you need to think about how you're going to, coming back to the evidence, how you can prove that you're better. So once you've got a service that people want, and you've got this evidence to prove that it's a service that people should buy, the next thing is to go out and tell all of these people you need to be telling. So that involves being found when somebody's looking, whether they're searching on Google, home care, Barnet, or wherever it is. Are you on the list? What directories do they find? What other websites do they find? Which social care providers, professionals do they talk to? Which directories do they look in? Who are they talking to? So it's worth thinking about that journey and who are the key people and what are they saying? Are they mentioning your organisation? Are they not mentioning your organisation? How do you need to develop those relationships or improve your online advertising, for instance? The next part is actually making the phone to ring. And quite critical in that is going to be your website. So once you've told all these people, they said, ABC Home Care, they're an organisation that perhaps you should talk to. You then want people to go to your website and you want to be clearly conveying all of those messages with that evidence. And you want to know if your website's doing its job. If you've had 100 people to your website and you've only had 2 calls, why is that? What's the problem there? So it's important to understand if your website is doing its job. The next thing is about answering the call. I've already said I've done quite a lot of mystery shopping of home care and other care providers, and I don't know if you've called your own organisation, but the vast majority are. Actually, they're getting better. Organisations are getting better and a bit more switched on about this, but there are a lot of people who don't know how to handle that inquiry, and that's no criticism of them, but they're carers. They're used to scheduling staff. They're not used to dealing with those inquiries. So it's important to think about who answers that call and how you get across the empathy and the messages you want to. And then finally, in terms of winning the business, obviously you need to be better than all of your competitors, and that's based on the factors that the individual has. So if I'm looking for care for my mother, let's say, who has dementia, am I looking for somebody who's a specialist dementia provider, or is the key thing that they've got a certain type of staff? Is it that they've been around for a certain amount of time? Is it that they've got call monitoring or what have you? So it's down to my criteria, and obviously how quickly you can respond to that need, particularly if it's an urgent need. And the final part of the process is an understanding why you didn't win certain business, and then going back and obviously fixing it and improving your messages, improving your website, improving your call handling. So it is a long process, and people can fall out at any point throughout that process. So I think in terms of what marketing is, I think it's important to think about it holistically, not just let's write a brochure, let's write a website, and then we've done our marketing. Just finally, each inquiry you receive or don't receive could be worth thousands of pounds to your organisation. So the next thing I just want to touch on is tracking marketing effectiveness. So when you get a call from the directory next year that you advertised in this year, you're going to want to know that they're saying, please spend another £1,000 with us. I suppose the key thing you want to know is, has it worked? Should you spend the money again? Should you stop advertising in the local paper? Did the door drops you did work? Was it because you put it through the wrong doors? Was it the wrong time? Was it because your website didn't do its job? Or was it because actually you had no visibility of the inquiries that are coming through? So it's important to track all those part of the processes, of the process. So there are some things that are easy to track these days. Anything online is fairly easy to track. If you've got analytics on your website, if you haven't got analytics on your website, please go away and get it put on your website. Google Analytics is free, and all you need is your website developer to put some code on there, and you can see the type of people that are coming to your site, what they're doing, where they're going, and where they're falling out of the journey. It's easy to track inquiry forms from your website if that's the way you're doing things. So online is quite easy. It's much more difficult to track inquiries from printed directories, the local paper, and emails if they're coming into a general info at mailbox or going off to various people across the organisation. So when it comes to tracking marketing effectiveness, I think there's two things to think about. One is you're either relying on your staff, and that means training them, to recognise that it's an inquiry. So when someone calls up and says, "Oh, how much is your home care?" they recognise, "Oh, that's an inquiry," and they go through a process of capturing the information you want, logging that inquiry, and also potentially admitting that inquiry didn't convert. Or you can. Some organisations. I've been using telephone numbers for a long time in my employed world, and with some providers I've worked with. You can use different telephone numbers for different campaigns and track how many calls you're getting. In particular, let's say that you do decide to spend £3,000 on some door drops. You take the plunge. I mean, if you do that, I would think very carefully before you do that. But if you do that, surely it's worth spending an extra few pounds to have a phone number to say, well, how many calls did we get? So I think it's worth thinking. You can also record those calls and use that for training purposes and see whether people who answered those followed the process that you wanted. So in terms of the metrics that you should be looking at, website visitors using your Google Analytics, inquiries, so that might be the calls. If you've got specific numbers, you can check how many calls came in. Email forms, how many inquiries were logged in the system on bits of paper, how many assessments and visits you made, and the number and value of those customers. The important thing is to capture, as you go through the process, is to capture the inquiry source. So was it the directory? Was it your online ad? Was it a referral from a member of staff? And keep that throughout the process so you can see how many inquiries you got, how many customers you got from each of those different pieces of marketing activity. Then you'll be able to go back and tell the person at the directory, yes, we'd like to advertise again, or no, thank you, it didn't work for us. This kind of moves us on, I think, to marketing budget. So in terms of setting your marketing budget, it's useful first of all to think about what is the overall value of that customer to you. A general customer, you may have one type of customer, you may have multiple types of customer, but what is a typical customer worth to you over their lifetime? For a home care provider, let's say that might be £10,000. It might be different for your organisation, and you need to calculate that. Then once you know that, let's say it's £10,000, you might then say, well, based on profitability, etc., we could, if I said to you today, I've got a customer, would you give me £500 for them? You might say, oh, I don't know, actually we'd give you £350 for them, or actually we'd be willing to pay £700 for that customer. So if you can think about that, then you know that if you do an advert, £1,000, you need to get 2 customers from it. And at least you've got a way of tracking what is and isn't effective. And I think it's important to think about that before you do any promotion. And then you can monitor that against what you're doing. So before you invest any more money in marketing, I think there are 3 things to think about. Assuming that you're providing a service that people want, the 3 things are, first of all, are people aware of your service? And if they're not, can you tell more people? Secondly, do you have a problem getting the phone to ring? Is your website working? And thirdly, are you failing to convert inquiries into residents of your care home or service users for home care organisations? And that comes down to improving your inquiry handling. And I think the important thing is to focus actually in the reverse order, because there's very little point in going out and telling more and more people and spending more and more money on advertising if actually your website's the problem or your people are not handling inquiries effectively. So just before I open up to questions, most of you have got some information on, I think not everybody's got information about the toolkit. I've got some information up here if you haven't got anything on your chair. But in response to working with so many providers struggling with all of these issues, I mean, I think hopefully you can see that marketing is about quite a lot of things. And the toolkit is basically the advice that I've given to various organisations. I find that whichever organisation I go into, I'm basically saying the same things. So this is an online resource. If you're interested, there's over 80 videos on there. It might seem quite daunting, but there's a lot of content. It goes into a lot of detail about all of these various aspects, from how to carry out mystery shopping to how to answer the phone, how to define your messages, what to look out for if you're looking to do online directories, advertising. There's 80 topics there that will help you to identify the mistakes that typical organisations are making, and hopefully help you to avoid that. And we're offering a one-day access to that for £49, so it's like a bespoke marketing training course for you, if you like, and if you decide to subscribe on an ongoing basis, then obviously you can do that. If you do that, we'll include telephone consultancy with that. So I've come to the end of my presentation. There's just over 5 minutes left for questions. Yeah, we've got a microphone here. Two at the front.
Hello, David Weatherly from Warner Care. I'm based in Lincolnshire.
Hi, David.
CCGs seem to be my bugbear at the moment. They're brand new and I don't know how to talk to them.
Yeah.
I feel they're an important person. How would you market to them?
I think, you need to get in front of them, and you need to tell them who you are and what you do and why you're different and better, and how you can respond to their particular needs. I think the important thing is understanding what they're looking for, if you and everybody else in this room and everybody else in the healthcare sector is wanting to talk to these people. I think that's the critical thing. If you're just going to send them a leaflet and say, here's our home care organisation, please refer to us, I think you're probably not going to get much from that. So I think the critical thing with CCGs or with local authorities is to first of all, understand their agenda, and then understand who are the people you need to be talking to, and then try and find ways of engaging with them. Is there some can you share information with them? Can you do some kind of training course for them? How can you help them in their job? So what can you provide to them that will help them? Because they're struggling, but they're going to be bombarded by hundreds of people, and I think actually getting some time with them is going to be quite difficult. So you need to tell them what's in it for them. Really, that'd be my advice. So we've got another gentleman over here.
My name's David Hogarth. I'm from Westminster Health Watch. You don't say anything at all about the possible negative effect of an underpaid carer getting no travel time, not being very interested in the job, then doing it badly. How far do you think that marketing can overcome that? Perhaps you can answer that question.
Well, I don't think marketing can overcome that. I think what I'm trying to talk about here is presenting an organisation. Marketing is about presenting your organisation in the best light, and often it's focusing on the strengths and downplaying the weaknesses. And I think the important thing for anybody out there who's trying to choose care is about understanding who the good providers are and who the not so good providers are. So I think, I don't think marketing can help improve that as such. I think that's down to quality assurance and monitoring and operational management. But I think marketing can help the good providers to tell people what they should be looking for, and to stop them going to an organisation that is providing less good care.
Should marketers have an influence or aspire to have an influence on the supervision, on the supervision of the care?
The question was, should marketers have an influence on the supervision of the care? I think it's marketers' responsibility to present the organisation in a true light, and not to lie, and not to. I think it's everybody's responsibility to ensure there's good care, and marketing comes into that you can. Let's talk about customer satisfaction surveys or staff satisfaction surveys or what have you. You can use surveys, for instance, to gather information to help you to improve the operations of your business, but you can also use that to present your business, to ask the questions that allow you to present your business in a positive light. So I don't think it's marketing's job to sort out the care workers who are disgruntled. I think it comes into internal communication. Absolutely, it's the marketer's job to help improve internal communication, so perhaps the care worker is not disgruntled. And I think a lot of external communication, I think an organisation that can't communicate internally is going to have problems communicating externally. Okay. To the end. Okay, if anybody wants any information on the toolkit that hasn't got any, there's some information up here. And you've got our contact details if you'd like to talk. I'll be around afterwards. Thank you.
Thank you very much. Thank you.
Yes, I'm here.
Ladies and gentlemen, if you have
Thank
got
you.
questions or want leaflets, could you approach Nicki at the back of the room, not at the front, as we have another speaker, please? Ladies, I'm very sorry, but we do need to move on. If you don't...